acne and young women having acne is so disturbing to the young child. So they come to us with a symptom of acne, and the next symptom is hirsutism, that is unnecessary hair growth in a female. That is Hello everyone, I am Dr. Vandana. I am an obstetrician and gynecologist. I am practicing in Kolar, Karnataka. I have an experience of 20 years and this is September, and September being an PCOD awareness month. So let me give few awareness tips about PCO, that is Polycystic Ovarian Disease. Today, Polycystic Ovarian Disease has become a gynec pandemic. You know what is meant by pandemic after going through all this COVID-19. So why pandemic? Because it is so extensive, so common, and incidence is so high that 1 in every 7 women are having polycystic ovaries. So you can know the incidence of it. So that means 15 to 20% of all the women are having polycystic ovarian disease. So because it is so common, let us know what is PCO or a PCOD. So there are so many terms for this, that is PCO means polycystic ovary, PCOD means polycystic ovarian disease, PCOS means polycystic ovarian syndrome. Basically all are same. So probably when it is called a PCO, when the disease is only confined to the ovary. It is called a syndrome when it has other characters like obesity, infertility, irregular periods. So the syndromic appearance of PCO, then it is called a PCOS. So now 50% of the polycystic ovaries syndrome gets unnoticed because people don't recognize that they have a polycystic ovary. So when does the people recognize that they have a PCO? So let us know what are the symptoms and what symptoms they come to us. As an obstetrician and gynecologist, we see so many young girls, young women coming to us with all types of symptoms. The most common symptom where the PCO comes is irregular periods. So the irregularity in the periods can be delayed period or a very early period or a very prolonged period or very scanty flow. So there may be different types of irregularities in their period. So whatever complaint is there, so we should analyze it and then come to the conclusion. Then the other complaint with which they come are multiple acne. So at an young age, who are very conscious, teenage girls having acne and young women having acne is so disturbing to the young child. So they come to us with a symptom of acne, and the next symptom is hirsutism, that is unnecessary hair growth in a female, that is on like mustache, the beard, all this unnecessary hair. This is called hirsutism. The other thing is the sleep disturbances. One more most importantly for young girls is hair loss. So they will have a scalp hair loss or decrease in the total amount of the hair what they are having. And the other one is weight. So obesity. Obesity is also one of the common symptoms where they approach us with irregular periods. So these are all the symptoms with what they come. There are many other associated in this syndrome, but these are the commonest symptoms with which they come to us with all this PCOD. Once we know the symptoms, then the next thing is how to diagnose this PCO. So worldwide, there is a criteria called the Rotterdam criteria. In this Rotterdam criteria, there are main 3 important things. Those are irregularity in the periods. What all I said, there is irregularity of the periods. The second thing is the clinical or biochemical changes that we check during the examination and also investigations. And the third one is ultrasonography. By doing ultrasonography, we will know the polycystic pattern of the ovaries, not only the pattern, the stromal thickness, and also the number of the follicles. If the number of follicles are more than 20 in each ovary, that is diagnosed to have polycystic ovaries. So once we had diagnosed with all this Rotterdam criteria that she is a polycystic ovaries, so every patient will ask why I got it, why me, okay. So once they tell all this, so they are going to ask these questions. So we should know what are the causes of this polycystic ovaries. So once the diagnosis is done, so let us go into the causes. So the commonest cause, till now the exact cause of polycystic ovaries is not known. The commonest causes or the theories what has been given for the polycystic ovaries is, the first one is genetic. How much genetic has a role in this, because we had never seen our grandmothers or the mothers facing this polycystic ovaries. Only our generation. When I was doing post graduation, it was just starting. The chapter of polycystic ovaries was just one page. After 10 years, now the polycystic ovaries has been extensively studied. Now in 20 years, the polycystic ovarian chapter or the discussion about the polycystic ovarian disease has become so big that it can be written as a textbook. So that is the extensiveness or the incidence of polycystic ovaries. So because the genetic factor, that is grandmother, mother, there may be a role of genetics, but this may not be the exact reason for polycystic ovaries. Then next comes insulin sensitivity. So the insulin sensitivity decreases drastically in polycystic ovaries. So this is the reason for high blood pressure, increase in the cholesterol, diabetes, and all others related to insulin resistance. So this may be an important factor. The other important factor what theoretically made out is a low-grade chronic inflammation in the body. So this low-grade inflammation in the body also causes changes, which also causes polycystic ovaries. And the most important is the lifestyle modification. So we are used to sedentary lifestyles, no exercise, increased intake of food, then loss of sleep pattern, and many people are not used to eating fresh food like packed in plastics, processed food, or the one which is refrigerated or microwaved food very frequently. So these are the lifestyle changes which has led to the PCO. These are all the theories what has come out. But now the part is where and when you have to treat the patient. If the patient is not having any problem except the irregular periods, you can treat only the cause. The best thing in the treatment part is lifestyle. Okay, so lifestyle modification is the best method of treating polycystic ovaries. If you see a patient with polycystic ovaries with all this what I had mentioned earlier, like sedentary lifestyle, eating processed food, abnormal sleep pattern, and also stress, then all these factors, it's not easy to correct, but with efforts they can surely change their lifestyle so that without any medication the patients can be treated with simple lifestyle modification. Then comes the treatment with other drugs. The commonly used drugs, that is zinc, chromium, inositol, then insulin sensitizers like metformin. There are so many drugs. So let us not come into the pharmacological aspects of the PCO. So there are many treatments available for the PCO. Instead of stressing on the treatment part and all the medications what we use in PCO, the best thing is to stress on the lifestyle modification. So whatever may be the cause or the onset of the PCO, if we are going to change our lifestyle, we are going to achieve very good success in treating polycystic ovaries. May not be curable, but it will be under control, as polycystic ovaries doesn't stop with just young age where only there is period abnormality, hair loss, acne, hirsutism, but on a long run, if the polycystic ovaries is not attended properly, it causes 50% raise in the endometrial carcinoma later, and there is a high probability of diabetes, hypertension, high lipids, and cardiac changes. So these are long-term efforts which will cause even debility and lifestyle abnormality, which will cause long-term efforts to the person. At the end, my take-home message is, it is an integrated approach where not only medication but a lifestyle modification is very important for the treatment of polycystic ovaries. So in this integrated approach, there is nothing to be panicked about the PCO. So there are so many methods like weight loss, Then comes stress-free life by attending yoga, meditation, all these things. Correctly following the sleep and wake up pattern throughout your life, and also avoid taking junk food, that is the processed food, parcel food or the refrigerated food, and eat the fresh food. So with all these minimal changes in your lifestyle, what I already mentioned, about 50 to 80% of the symptoms of the polycystic ovaries can be cured. Hope this video was helpful to you. Thank you for watching. Bye bye.